The opioid crisis is only getting worse here in Erie County.
A new report is shedding light on the victims of heroin overdoses, how old they are, where they live. There were at least 201 heroin-related deaths in Erie County last year, and county health officials expect that number to double this year. News 4's Dave Graber tells us who's most at risk here. Dave?
Well, Don and Jackie, there were so many deaths related to opioid overdoses last year. Final numbers for 2015 can't yet be tallied. That's because there's a backlog of toxicology reports, which is the test that's required to confirm such deaths. Now, Erie County has long considered the fight against heroin and other opioids to be a public health crisis. According to the Erie County Health Department, 201 people died as a result of opioid overdose through the first week of October. Now, the rest of 2015 is still being tallied by the medical examiner's office, which needs toxicology results. There were 128 deaths in 2014, and preliminary numbers are expected to increase. The county's numbers also shed light on a profile of the average death. Now, if you take a look at some of these numbers here, there are more whites than any other race who died as a result of overdose. About half of them were from the suburbs, and the average age of death was younger than 40 years old.
We really feel that this is a problem throughout Erie County. It really shows no boundaries with demographics, with location of residence, with age, with income. We're seeing it all over, and so we really need to embrace this as a problem throughout the county. This addiction epidemic is really ratcheted up to being a public health crisis.
Now, as a result, the county will be bringing together law enforcement, mental health, medical, and other agencies next week to begin laying out a program to curtail opioid deaths. Now, that includes steering low-level drug offenders away from prison and into rehabilitation. Reporting live in the newsroom, Dave Graber, News 4 at 5.